Today we're going to talk about why it's a good idea to keep your umbilical cord after giving birth. I'll be honest, I regret not saving my umbilical cords. After looking into this topic for this video, I realized I should have held on to mine. Okay, so the umbilical cord is like a special connection between a mother and her baby. It carries oxygen and nutrients from the mother to the baby and takes away the baby's waste to be eliminated maternally. It's kind of like a magic when you think about it. So first of all, we should understand that umbilical cord contains two main components: cord blood and cord tissue, which is saved separately. Cord blood is the blood in the umbilical cord and placenta. It's full of special cells that can turn into different types of blood cells, red blood cells or white blood cells, like the ones that carry oxygen and fight infections. Cord tissue, on the other hand, is like a jelly in the umbilical cord. It holds cells that can become things like bones, cartilage, and nerves. It's pretty amazing. So why you should exactly consider keeping your umbilical cord and cord blood and tissue? Because they contain special cells that can be super helpful in medicine. Nowadays, stem cell therapies with cord blood and tissue are pretty common. They have been used to treat lots of different illnesses like blood cancer and problems with the brain and nerves and immune issues. Many people have gotten life-saving treatments with stored cord blood. These cells can also help people who are getting chemotherapy or radiation treatments for cancer because they replenish the blood and immune system. Also, scientists are looking into using cord tissue cells to help with brain problems like cerebral palsy. They're also checking if they can help with type 1 diabetes and heart disease. Another important thing to know is that these stored cells match your baby's genes and often the siblings and family as well. So if someone in your family gets a disease that needs a special match, you won't have to worry about finding a donor in a hurry. So think of it kind of like an insurance plan for your family in the future. But know that while there are so many potential benefits, it's not a guarantee of future medical use. Okay, so now how does the collection process work? It's actually quite simple. Cord, blood, and tissue are collected immediately after the baby's birth. It's a safe and painless procedure that doesn't pose any risk to the baby or mother. After collecting them, they are processed, tested, and cryopreserved, meaning frozen and then stored at super cold temperatures. Usually it is recommended to save cord blood when the baby is born full term because it has sufficient quantity of stem cells for future medical use. Okay, now let's talk about how much it costs to save cord blood and tissue. The price can be different depending on a few things like where you live and which service you choose. If you want to save cord blood and if you want to do it privately, collection and processing at the start might cost around $1,000 up to $2,000, $3,000. Then you will pay about from about $100 to $300 yearly. Some places offer extra services like saving the cord tissue, which makes it more expensive. But if you decide to donate it for public use, that's usually free. Of course, costs can change, so it's a good idea to look into different options and find what's best for you. Also think about the yearly fees when you make your choice, because it's not just a one-time payment. Saving cord blood and tissue can be very promising and in terms of health and well-being, but of course, do your own research and explore different options and consult with experts in the field and your doctor and make an informed decision that suits you and your family. All right, that is it for today, and I will see you next time.